I would like to follow up on that from Colorado and point you towards principle number 2, which is an affordability standard should be a progressive sliding scale that's relative to both income and expenses. We all know that lower income people have a hard time of meeting the basic necessities of life as it is. And I don't think that any of us should be forced to live either in substandard housing or to have to settle for unlicensed or even possibly unsafe child care in order to be able to pay our health insurance premiums and other health care related expenses. A progressive affordability standard is needed to ensure that fairness and to protect all of us, especially those of us that are struggling to make ends meet that fall into the lower or moderate income brackets in the United States.
Good morning, my name is Denise Pearson. I'm Executive Director of the Colorado Consumer Health Initiative, and I'm here today representing a sort of unique partnership in Colorado called Colorado Voices for Coverage, which includes 4 state-based nonprofit organizations, my organization, the Business Health Forum, the Colorado Council of Churches, and the Colorado Progressive Coalition. During the last 3 weeks of August of last year, this group reached out to our networks throughout the state, reaching faith and progressive and community and healthcare constituencies to organize 90 workshops that reached 1,100 people in Colorado in 6 different geographic regions. So it's a pretty large undertaking. At these workshops, low to moderate income Coloradans with incomes of up to 500% of federal poverty level completed in-depth budget household surveys based on their last month expenses and income. So I just want to highlight 3 things about that data collection. Each of the partners really worked with our local context and worked with people in those communities, both to organize the workshops and to reach people in those communities. And we had these budget workshops at hospitals and community fairs, libraries, colleges, you name it, anywhere we could reach people. Secondly, the geographic representation, while not comprehensive, because Colorado is a huge state, was pretty good. We reached 6 different areas, which included Denver and outstate and urban and rural and frontier areas, as well as resort and agricultural communities. So we did our best to understand some cross-section of our state. And lastly, I think the most important thing I want to echo is something that's been touched on, is each of these budget worksheets really represents the story of an individual or a family who is struggling to afford health care, struggling to make ends meet, and actually struggling to contribute to a state that they love and find a way to be in that state and be part of it. And the most important thing I think about affordability when we think about it is putting people first, that they've got to be at the center of the decision making that we're doing. The last thing I want to say is that Colorado Voices for Coverage actually is dedicated to building the movement for healthcare reform at the state and federal levels. So it wasn't just going out and doing the surveys. This summer, we're taking a report, and for those of you who didn't get cream-colored folders, you might want to pick one up on the way out as well as the report. We're going back to all those communities with the report to say, okay, this is what we found out about our communities here in Colorado, and what do you want to do next? What are the next steps we can take to keep you engaged, to push the momentum for healthcare reform?
Good morning. My name is Elizabeth Fader, and I'm a health policy analyst at the Colorado Center on Law and Policy and the author of the Colorado Affordability Study, The Cost of Care. And thank you so much for all coming this morning and being here. Today I'd like to quickly point out 2 of our key findings and how they relate to the second principle that an affordability standard should be structured on a sliding scale basis. First, we found that families that spend higher percentages of their total household income on health care reduce their spending on other essential items such as housing, transportation, and childcare. They also reduce asset building activities such as saving or spending on education. And these trade-offs become apparent when families spend as little as 5% of their total income on health care and can become very substantial as the percentage of income spent on health care rises. These trade-offs are especially problematic the lower a family's income is on the scale. Such families' spending is already very low, and further reductions can be dangerous if they mean that families are unable to keep a home properly heated, they're unable to maintain a vehicle in safe condition, or they're forced to rely on substandard childcare. A progressive affordability standard is necessary because purchasing health insurance should not jeopardize a family's safety or their long-term financial security. Second, Our second finding, well, we think that a progressive sliding scale based on income is a really excellent start and critical. Our data also showed wide variation within income brackets, meaning that even families in the same income bracket could have very, very different amounts of income left to spend at the end of the month. And this variation occurs because family circumstances can vary quite substantially. For instance, the higher cost of child care to younger families, higher transportation costs in rural areas, different amounts of student loan payments or other debts that people carry, or unexpected adverse economic events can all impact a family's ability to pay for health care. In fact, we found that at the bottom quartile of all income brackets under 400% of poverty had negative balances at the end of the month. A standard that's based only on income doesn't address this wide variation within income brackets and would do little to help these families in the bottom quarter. So we respectfully suggest that policy should strive to be flexible enough to take this ability to pay and not just income into account. Thank you for your time today.